Welcome back to Talk of the Town. Joining me now is Ricky Molina with Encompass Health, and they have just passed their 2-year anniversary, so congratulations on that.
Thank you very much.
So for people who don't know about you, tell us where you're located and kind of what you do.
Sure. So we are located in the heart of Bluffton, right on the 170 highway. I call it the WHHI highway, right across the street from Sun City.
Okay.
And we've been there about 2 years. In June, we opened our doors in 2018. So we probably treated a little bit over 1,000 or 1,500 patients right now. And unfortunately, but fortunately, we're really in the right place at the right time and seeing the uptick in volume right now. And so we're certainly getting the word out right now and just making sure we're connecting with Bluffton and Hilton Head residents and, of course, Beaufort County residents to make sure they know it's brand new. It still smells new. We're still offering great services that have not been offered here before. Just excited to be part of the community.
So what are those services that haven't been here before?
Okay, so when you think of a healthcare setting, you think of a hospital, and then you think of a nursing home or a skilled nursing facility. We're an intermediary in what's called an inpatient rehab hospital. We're licensed like a hospital. We have physicians, a pharmacy, nursing, respiratory therapy, 24/7, like a hospital. The service that is unique and different, though, is that we are all geared to make sure a patient can get maximum therapy. And so we really start and end our plan of care for patients on how much therapy we can get them, getting them back to the community.
Okay, Interesting. So tell us a little bit about how the environment that we're in now with COVID, as I said before we started, anyone's tired of talking about this yet, but we can't be tired of it because it's still here. So tell us about that environment that you're in now and what you're seeing and how it's affected you.
So it's unique. I've certainly never been through this. I know a number of colleagues and people I've worked with who've been in healthcare for years and years. This is unique to our era. What it's done to us, I think it's preparation and awareness. It's totally shifted the way we prepare to care for a patient. It's not so much in the actual plan of care as much as it is in the approach. So we're dealing more so with stressors and anxieties, fear, that truthfully there is no medicine or there is no thing you can do to just stop that. And so we're certainly seeing that and reacting a little bit to our families and our patients' families. They want to know about their loved one, but in order to help their loved one, we're really restricting a little bit some of the visitations we usually do. And so it's hard to see mom or dad or husband or wife or son or daughter recovering without somebody at the bedside. And so it has absolutely shifted the way we kind of treat patients and family members, the communication, the face-to-face, the hugs you used to get, all those things. We're really trying to make sure we can do anything to help kind of families recover.
And are you seeing some virtual things come into play there where they're doing FaceTime or Zoom or whatever?
Yes. I'll tell you, so Zoom is our friend right now. FaceTime, we do a number of iPad kind of FaceTime things with family members. Luckily we're fortunate. We're a single level facility, and so all of our rooms have these giant windows, and so it's very easy to see mom and dad and family member.
That's nice.
It's still a little weird, but it's working out, and families are really finding they can come and see their loved one at any point in time, and so it's a little bit different, but I think we're working well through it.
And are you a facility where somebody comes as the first place that they go, or does somebody come to you after they've been to the hospital and they need to come and now have rehabilitation services?
Right. So both. Okay. So a number of times we'll treat patients who come from a hospital setting. Maybe they've had a stroke or a heart attack or motor vehicle accident, jet ski accidents. We see those quite a bit. We're that place that you can come get a lot of intensive therapy for about 3 hours a day. The length of stay is probably 10 to 12 days, and we get you back to kind of life. Okay. Similarly, from home, if you're somebody who has a Parkinson's or MS or a neurological disease where this is progressive and you're still wanting to maintain your active lifestyle, we can come in and really just kind of work with this disease with you as you progress and figure out how you can still do life, but it's just going to be a little bit different. And so we see patients from all walks of settings. We admit from home, we admit from a hospital setting, we admit from other regions, and so we work closely with a lot of facilities right now.
Okay, and so we've got about 30 seconds left, but I just want to touch on what would you tell people in terms of trying to alleviate their fear of coming to your facility? Because we talked about that. It's real.
Loaded question. I love it. Trust. I think you got to trust the healthcare worker right now. We are there to make sure everything around you is limited and minimized. Our job is to make sure you're there to focus on the one thing you're doing, just recover. We've done a number of things to limit exposure from our staff, from visitors, from everything like that. And so I think if people can really understand, we're still open, we're still here to help you. Just come in and focus on recovery. We'll get you back home.
Well, thank you so much for being here to tell us about
Thank you so
Encompass
much. I
Health.
appreciate it.
And we'll be right back with more Talk of the Town.